Take a big breath.
Dr. Ken Baczynski never had his sights set on practicing medicine in the city.
I sought out a rural practice because as a family physician, it afforded me the opportunity to have a wide scope of practice. And to me, that variety is very enjoyable. That's like the best part of my job.
Enjoyment is what Baczynski gets at his practice here in Garrett County, Maryland, one of thousands of non-metropolitan areas in the U.S. experiencing a physician shortage.
We could probably use about 5 more primary care physicians in our community without anybody suffering any loss in their patient volume.
Baczynski treats patients of all ages with many different ailments. He's also one of just 2 doctors in the community helping to deliver the 300 babies born here every year.
Do the math, that's a lot of nights.
In addition to the existing shortage, he says many doctors in the community are nearing retirement, and recruiting new physicians is often a challenge.
Even though a quarter of the population lives there, we only have 9% of the physicians in this country who actually serve in rural areas.
People living in rural America don't earn as much as urban dwellers, and they tend to be older and sicker than those living in cities. These factors only increase the demand for physicians in the country, but a lack of work-life balance, limited medical resources, and relatively small incomes can make rural medicine a tough sell to graduating medical students. Last year, only about 1% of new doctors indicated they plan to practice in rural, underserved areas. Nevertheless, Preston Lastly plans to buy in. He just graduated from Georgetown School of Medicine on an Air Force scholarship.
I feel like being a country doctor one day after my time in the Air Force is over is definitely my goal.
Rural health professionals and advocates agree. Exposing students and residents to rural medicine is key to boosting the physician workforce in those areas. Gladys Hernandez is one of Lastly's classmates. She's heading to Chicago to train in an underserved area. Both new doctors say where they're from has influenced where they're going.
I've always been in big cities, and when I see myself practicing in the future, it's in a big city.
In addition to exposure, others in the medical field say boosting a primary care base and ramping up debt relief programs may help heal the problem.
Had our hospital not paid off my student loans, I would not have been able to come here.
Despite financial concerns, the number of physicians in rural communities is actually rising, but the numbers don't account for population growth or physicians who don't see patients. That means doctors like Baczynski still experience the side effects of rural physician shortages.
I'm very tired. I'm very tired all the time, and I barely ever get caught up.
But Baczynski says he feels called to care for the residents of his rural community, and sleepless nights are just the price he pays to do that.
To step back and say, you know, what I've done here matters. What I've done here has made an impact on people. It's made an impact on our community. Is very rewarding, and that I think is what keeps me here.
All right, thank you.
You're welcome.
For UPI.com, I'm Melissa Hinkle.